Hi everyone, my name is Eunice Lasisi, and for this presentation, I'm going to talk about hypophysectomy. For my outline, I'm going to look at the definition, types, indications to show you have to undergo this procedure, complications that can arise as a result of undergoing hypophysectomy, and the role nurses have to play to avoid some of these complications. Hypophysectomy is a surgical procedure that is carried out when medical treatment is not able to correct hyperpituitarism. It is the total or partial surgical removal of the pituitary gland, which is located at the base of the brain. This procedure is usually done to treat conditions related to pituitary gland, such as tumors or overproduction of hormones. In cases where medical treatment and non-surgical treatments fail to control hormonal imbalances or shrink tumors, hypophysectomy may be considered. There are two approaches to undergo hypophysectomy, and the first one is the transsphenoidal. And in this procedure, the gland is removed through the nose using endoscopy. The second one is the open craniectomy, and this procedure also involves the gland being removed through an incision in the skull. And here is a picture showing the pituitary gland, which is usually looking like a pea-sized organ situated in a bony structure within the skull. For indications to show you have to undergo this procedure, the first one is hyperpituitarism. And this is when there is excess secretion of hormones, that is the growth hormones, which can lead to gigantism. And the second one is the Cushing syndrome. That is when there is too much cortisol secreted. Complications can occur after you have undergone this procedure, and some of these complications are loss of smell, taste, senses, and visual defects. Infections can also occur. There can also be cerebrospinal fluid leakage, hemorrhage, headache, fatigue, weight changes, or mood swings. And these are all some of the things that can arise. So some of these things needs to be looked at whenever any person undergo this surgery. And as a result of that, there are some roles nurses have to play in order to avoid some of these complications or make these complications very minimal. The first one is checking of vital signs to identify any complications. There should also be proper wound care to prevent any infections. Administration of steroid with food to prevent gastrointestinal bleeding. Monitoring for CSF leakage and bleeding. And also monitor for sensory defects. There should be frequent follow-ups to adjust medications if there is the need to, and then also lifestyle adjustments such as dietary, regular exercises can also be done in order to make all these complications very minimal to get a very successful procedure done. And these are the references I used